Welcome back to Health Focus. Again, I'm Ann Rodriguez, your host. We're delighted to have with us Dr. Aleya Karim, who is a psychiatrist who deals with children and adolescents. Welcome to Health Focus, Dr. Karim.
Thank you.
Tell us a little bit about yourself in terms of how you came to psychiatry as a profession.
I graduated from Bangladesh, and I was always during my medical school, I was getting involved in the emotional component of the patient along with their physical illness. And I didn't have that much, psychiatry is not that developed back home, so I didn't pursue that, but it was always in my nature. Like I always end up asking about their emotional component, how their suffering is affecting their life.
Sure.
So when I got married and I came to this country and I did my residency. That was my opportunity to, the psychiatrist so developed here.
When in your early medical training, I think I saw that your areas of interest, or at least you were in, I see Department of Cardiology in terms of an internship. So when you went on to your residency, that's
residency, yes. Lots of, I was interested in cardiology also. I did some training on cardiology, but always back of my mind when I came here, and I think that I got the, everything is so advanced, there's opportunity, and we studied, and I learned more. And I have lots of family members who are undiagnosed and how they're suffering.
Well, let's sort of get right into it, because anybody watching this program has heard ADHD, and we are familiar with the hyperactive kid and clinical diagnosis and treatment and prognosis and medication. ADHD, and I only have to do this once, it's attention deficit hyperactivity disorder. And your special area of concern is ADHD going undiagnosed or misdiagnosed in girls.
Yes.
Yeah, let's start that conversation.
ADHD actually, it's a chronic behavioral disorder. It characterized by inattention, hyperactivity, and impulsivity. Is for, if you follow criteria, it's for 6 months at least, and meet criteria about 6 symptoms of each.
And this is usually presenting in how old of a child?
Yes, usually it should be according to criteria, should diagnose before age of 7.
Okay.
But all these things diagnosed mainly for male, and female symptoms is different. Symptoms is same, but expression of symptoms is different for girls.
And what does that difference look like in a young girl?
Like young girls, they are, as a whole, girls are more inattentive and boys are more hyperactive. So they have less behavioral problem, they are more inattentive. And boys are more disruptive, they are physically hyper. And girls they suffer silently because they have attention problem. They're not doing well at school. They're working hard 3 or 4 times more than peers to get to that, and they have low self-esteem that I'm not good enough. They develop anxiety in the process. But since they don't have any behavioral problem, like acting out behavior,
which is so easy to spot for the experienced teacher or a parent who's learning more about it.
Exactly. So girls are more, hyperactivity for girls shows as they're more talkative, they're social butterflies, they're more into boys, silly.
And all this is ADHD, and we just thought it was normal
ADHD,
girls.
this is maybe the girls, and they are maybe in the classroom, they're inattentive, they're maybe looking at the windows, playing with the hairs, and they are mainly more pleasure for the teachers because they're hyper. Sometimes they have to move around, they wanted to help the teachers. So they express the symptoms in more socially appropriate way. So that's why it get undiagnosed.
So you have a young girl with this behavior that isn't considered disruptive, may even be viewed at times as helpful, but it's still a disorder. It's now not diagnosed. What happens when that young girl becomes an adolescent or an adult with a non-diagnosis?
Yes. So In the process, they have low self-esteem, they develop anxiety, some kids develop obsession because they wanted to check, recheck whether they're doing everything right or not, or are they forgetting anything, or they're whole night they're up studying for the next test or any assignment and they're chronically always late. So they develop anxiety. Some kids develop depression, obsessive compulsive disorder. So when they grow up and when this anxiety is severe, depression is severe, then they get medical attention. And when they come to the professional, they diagnose their depression or anxiety, they give antidepressant or anti-anxiety medicine.
Well, that may not be the medicine
No.
or the diagnosis or prognosis that's
Yes, so
that's
they
real.
don't, if you are not aware of this, the sequence, it can be easily missed. So they give antidepressant and they are not doing better because their core symptoms is still there. So in the process, the actual treatment gets delayed and they suffer in the process. And when they becomes adult, on top of their inattention, disorganization, impulsivity, other responsibility added. Like as a mom, you have to do child care and you have to other family activities. You
Hold
have
down
to
a
be
full-time job.
exactly. Then they fall apart.
So let's talk about the treatment, and let's talk about a properly diagnosed young girl with ADHD. What does that treatment look like today?
Again, I wanted to, the treatment is because people have misconceptions about this stimulant. Lots of parents doesn't want their kids to be on medication. Because after all these years of research, advanced details, understanding about stimulant, how it works, how it changed their quality of life, still they have misconceptions that if they give stimulant to their kids in future, they are going to be drug addict or they will be. But it's actually other way around, because if you don't treat it and they become frustrated, helpless, and they self-medicate
with drugs,
other drugs,
right?
they get into other drugs. Treating ADHD, if they have ADHD, it protects people not to, like it's a risk is half to be drug addict.
Let's talk a little bit about what you do now in your profession. You are at Dominion Hospital for a good part of your work day.
Yes.
And then you are in private practice in the area.
Yes.
And you're in private practice with?
In